Across Nigeria, key populations, that is, people most affected by HIV, still face stigma, discrimination, and barriers to care. Mr. Martin Mgbor, Program Lead at the Enugu State Agency for the Control of HIV and AIDS, joins us to discuss what it really means to protect their rights and build an inclusive response. When every voice counts, progress becomes possible. This is Living Free, where knowledge empowers and stigma ends.
Good day, viewers. You are welcome for today's episode on the interaction around HIV and the key population. So, HIV cannot be separated from key populations because HIV is purely a component that addresses most of the issues that has to do with the key population. We're all aware that the key populations, some of them are living with HIV, and some of them are also not living with HIV. But currently in the States, they contribute to not less than 90% of HIV prevalence in the States. So there is a connect between the key population and HIV intervention in Enugu State. And that is overwhelming in as much as once we want to talk around HIV, we cannot intentionally exclude the key population. The key populations are those people that they are key to HIV prevalence. Why we say that they are key is because their activities has actually contributed in fueling HIV prevalence. Meanwhile, these key populations that we are talking around, they are a component or a consortium of group of community members. Sometime in the year 2014, we were able to do the first mapping of the key populations in Enugu State. And that was actually the first time we actually found out that, yes, these ones are key to whatever that we are doing. And at that time in 2014, we were able to map the female sex workers. We were also able to map the men that have sex with men. And finally, we were able to map people who inject drugs. And this same mapping was also repeated in 2018. And that of 2018, we also did an elaborate mapping of this key population. Though we were also able to track, the only thing that looks different from the one we did previously to the current of that of 2018 was that of 2018, we were able to look at those people that thrive within the areas of the internet, the social media, and the rest of them. So we were able to map them differently, apart from the physical mapping that we did for others. But currently, away from these key population components or typologies that I mentioned, there are also other emerging, community members that we have also, grouped them under the key population. And these are the transgender, and currently we have the minority group, especially when you look at LGBTQA+. So these are the people that makes up the key population. And currently in the States, they are there in the States, and a lot of activities are also ongoing, but currently there are no interventions targeting the key population in the States. For us here, we are also aware that there are a lot of factors, that fuels HIV prevalence. And some of these factors also are linked to some of the activities of the key population. Normally, we know that issues around poverty is one of the problems. And also, there are also some of them that are also involved in what we refer to as multiple concurrent partnership. And also, some of them, when you talk about key population, like I've mentioned, that also the LGBTQ are among them. So some of them also practice unsafe sex, and also they use other method of sexual interaction away from the one that we are always used to. And when you talk about the people who inject drugs, we have a category of both women and men among them, and they also use syringe, to inject drugs. And also, there is the possibility that when this one injects drugs, that same syringe that was used by the first person can also be used by the second person, because all of them are already influenced, okay, by that drug. So there is no proper coordination. There is possibility of one syringe and needle to be used like by up to 10 persons at the same time. And with this particular process, they can possibly contract HIV. And also in terms of relationship among female sex workers, yes, some of them makes use of condoms, while some also have what we call special boyfriends who they doesn't use condoms with, and still without actually knowing whether that person or that boyfriend is also HIV negative or whether the person is HIV positive. So these are some of the factors that fuel the prevalence. Like I've also mentioned that of MSM, those that are also under the community of MSM, they also make use of other methods of sexual relationship apart from the one that we usually know. So these are some of the trends that are, winding down HIV prevalence and keeping the state at a higher prevalence. There is total need for safe practices, and that is what we classify as prevention tips and prevention methods. And this cannot be overemphasized as far as we want to fight HIV to a finish in the state. And that having been said, this is also related to people, the key population, because prevention is key and prevention is better than to cure. So, but there is a connect between prevention of HIV and also the key population. The key population prevention methodology ranges from, number one, the use of condoms, and also having total access to condoms, and also having access to lubricants that will actually help to reduce friction because of those that practice anal penetration and the rest of them. Now, that is about the condoms and also the lubricants. We also have, like I'm talking about the condoms, we have the male and also we have the female condoms. The most important thing is that those two things are preventive methods for HIV. And likewise, I've mentioned the lubricants. Then away from that, there are other preventive tips. For the key population, there is need for orientation and reorientation. It should be a continuous process, because hence that is happening, it's obvious that people will get more knowledge about HIV. And once you get more knowledge, it's a prevention strategy to ensure that we have less people that are contracting HIV that are members of the key population. Then another prevention tips ranges around the need for uptake of PrEP. We've talked around PrEP. There are oral PrEPs. There are also injectable PrEPs that are called CAPLA. Meanwhile, the oral PrEPs has been there, but currently in the States, the key population doesn't access it currently because of the situation and because of US withdrawal of funding. So there are no PrEP provision for the key population. And that has actually reduced the level of prevention targeting the key population. And now we are talking about injectable PrEP. If that is also made available, or the oral PrEP is made available, that will enhance the level of prevention among the key population. There are other nitty-gritty things that we need to do to ensure that the prevention of infection of HIV among the key population is kept at the high esteem. And like I've mentioned before now, we have talked around orientation and reorientation. And also there is need for the production of information, education, communication materials. That is what we simply call IEC materials. These materials will actually help, okay? By the time they assess them, we can produce different types that talks at, that is targeting different thematic areas of prevention, so that when they read it, they will get more knowledge and more information. And away from that, we also need to look at a structural reformation. A structural reformation. Most of the key populations who are receiving more information about HIV, who are receiving more preventive information about HIV, are domiciled within the state metropolis. But that doesn't overrule the fact that there are many of them that are in the rural area. The issue currently now is, how do we reach those that are hard to reach? The people that we refer to as hard to reach are those people that are in the rural area, but they are key population members and they don't have any preventive information with regards to HIV. But most of them are also living with the virus, while some are not also living with the virus, but they don't have that information. And once you don't have that information, you are totally deformed. And that has actually fueled HIV prevalence currently in the state. So all these preventive measures, if they are taken into account, there is the possibility that the HIV prevalence currently in the state will be lowered. Enugu State Agency for the Control of AIDS has the mandate by the state government to coordinate the multi-sectoral response of HIV and AIDS in Enugu State. And that cuts across both health sector and non-health sector. Now, the issues around key population revolves around non-health sector intervention. And the state has been on the top of its heels to ensure that issues around key population are totally addressed. A lot of interventions has been rolled out. In fact, currently, not barely 2 months ago or 3 months ago, we just finished, we're just done with our state strategic plan, which is also, when you go into that state strategic plan, you will see a lot of activities captured targeting the key population. That is one aspect. That is what the state is doing. Another thing that the agency is also doing is that in the current annual operational plan for the state, also there are a lot of key population intervention activities captured in that particular AOP. So bringing in the state strategic plan and AOP activities together, by the time that the state or that the agency will run through all the key population intervention activities that are being rolled out there, honestly, there should be a very good, outstanding update with regards to key population. The agency is also at the helm of the affairs to ensure that everything that has to do with the key population are being uploaded to the cloud. What I mean by the cloud is that we have a cloud update, like the DHIS2. So every intervention, every area of coverage are also being uploaded in the cloud. Away from that, there are also other levels of interventions that the state is also doing with regards to key population intervention. We have the state prevention coordination meeting, which is also ongoing. And during that prevention coordination meeting, the key population, they are part of it. And not only that they are part of it, we even have a subcommittee only for the key population. So that will tell you how important the key population intervention with regards to prevention and all-round affairs that have to do with key population, what the agency is doing with regards to that. And once we continue doing this, it is possible that by the time we are done running our AOP, done running our state strategic plan, I assure you that the HIV prevalence of Enugu State will actually drop. And not only dropping, we have also mentioned here in this episode that the key populations, they contribute not less than 90% of HIV prevalence. By the time we are done with the SSP and AOP, it is possible that they may not contribute up to that 90% again. It is possible that it will be lower because there are a lot of activities and intervention focused on key population. Okay, to all our viewers in this particular episode of Interaction that has to do with HIV and the key population, we really want to appreciate you for being here for us. And very, very important for you, wherever you are and you are hearing our voices, it is very, very important you know your HIV status. That is the beginning of knowledge. That is the onset of whatsoever that you are thinking about your healthy environment. So it is very, very important that you go out there and know your HIV status. And once you get tested, please know that you have the right to repeat that test after 3 months to actually certify your HIV status. And away from that, please, if you are playing, play safe. make correct and consistent use of condoms. It is very, very important. It is also good for you if it is possible for you to totally abstain from sex, so that also you will help the state to fight HIV to a finish. Well done.